Sorry. Okay. How to reach out for help when we're struggling with mental health. Let's talk about it. Hello and welcome everyone to another episode of Let's Talk About It podcast by SafeTalk. So just like last time, we are going to talk about mental health help, except this episode we have a mental health professional with us, which is Miss Aishah Diyana. Welcome, Miss Aishah. So Miss Aishah Diyana is a licensed clinical psychologist at Mentem Psychology with years of working in the field. Welcome, Miss Aishah. How are you doing today?
I'm doing good.
Thank you. Thank you for coming. And I'm excited to start the conversation and hear your insights on our topic today. So just for a little recap about last episode, we talked about mental health help with our previous guest, which is Kira, who is my best friend. So we talked a lot about her personal mental health journey, and we covered everything from like positives and negatives, and it's mainly just kind of comparing the expectations and the reality of reaching out for help. So that's why today we're here to kind of have your own input as a professional about this. So if you don't mind, let's get started.
Sure.
Right. So with mental health, right, I think now there's a lot more conversation surrounding mental health. Even if it's not specifically mental health, I see that people are more open talking about their problems, their struggles, their emotions. So in general, people are aware of their well-being. So with that said, are mental health professionals overwhelmed with too many patients?
Right. I love that question because I think that question would have never been like a very important question to ask if you asked that question probably 3 years ago before COVID.
Yeah.
Right. So after COVID happened, like the MCO, I think there was like a increased awareness of like mental health because of the crisis.
Right.
Then after that, there was like an increased demand for mental health services, right? And so by then, that's when mental health professionals were kind of put in the front liner and to kind of assess and give the services that was needed.
Right.
In terms of whether we're overwhelmed, I think there's different levels of like tiredness and fatigue. But specific to mental health professionals, there are different types of fatigue that can come with it. It can be compassion fatigue, can be like emotional burnout, right? But what is good is that because we are from the field that provides services for mental health, we're also able to get resources that we give to other clients, right? So we can sort of assess, okay, where are we at right now as a therapist, for example? We know what the signs are. So then we know where we can get the help that we need. We have our peer supervision. We make sure that we can reach out to other therapists. We have our own personal therapist, so we know how to manage our own burnout. All that. So yes, I think the tiredness exists, but at the same time, we also know the resources.
That's great. So do you see like an increased amount of clients after the COVID happened?
Yeah, of course. I think before the COVID, online services like online therapy wasn't that common. I think, it wasn't really that common at all. So after the MCO, then it became more accessible, which was great. It was good. But it also, I think at one point, there were just so many demands, but very little supply, right? And that kind of became quite tough for a while. But thankfully, I think now there are more services out there that are accessible to all people from all walks of life.
Yeah, correct. Yeah, when you said COVID, even like me and my friend, the previous guest, we were also more into like mental health help during the COVID era. And we noticed like she had her treatment in HKL and mine was in Hospital Putrajaya, and there's like so many patients, such a long waiting time. And then even like each appointments, we don't necessarily get to see the same doctors. And then I had to also transfer to mental health center, I think it's called Mentari in Putrajaya. And then they wanted to refer me to a psychologist, but that also takes like 4 to 6 months. So they still do like monthly appointments depending on how severe your cases are. But there's like so much patients and there's so many, it's hard to keep up with the appointments because every time we go, we have to wait like 4 hours and stuff.
It's a whole day thing.
Yeah, correct. And I don't know if you want to share, but based on your own observation, do you think the government mental health care system is efficient enough?
Right. I think there's always a lot of things that can be improved on.
Yeah.
Great thing is that now people know, mental health is important. So that's already like one roadblock that we've already kind of overcome, which we didn't managed to do that last time. Right now, there's more awareness. Now we need to have more availability and accessibility. Maybe the services are available, but whether they are accessible to a lot of people, and not being 4 hours of waiting time. Right. That means you have to take off from your work, for example, right? And that will affect your well-being as well.
Right.
But then in reality, I think a lot of this sort of system is also common in other countries as well. I think Malaysia is a work in progress when it comes to making it more accessible, and I can only hope that it continues hitting there.
Yeah, correct. And that's why I think some people would opt for private mental health care as well, going to therapy. It's just that you have to take out more pocket money for that, but you would get like a better system and much more manageable for your time, especially like you said, if you're working. And with that said, we were talking about barriers as well, right? So based on your experience and like cases that you've dealt with, what barriers do people often face when trying to access mental health care?
Right. I love that question so much because we can talk about, the big plans, what we need, but we don't acknowledge what the barriers are first. We can't really go far. So when we talk about barriers, the first part is actually financial barriers, right? So for example, as you mentioned, there's government and there's private. And if you want to go government, the thing that you have to sacrifice could be like more time, right? When you go private, the thing that you have to sacrifice would be like the finance for it.
Right.
So of course, maybe the quality might be somewhat the same, right? We can't really measure that. But in terms of like attentiveness, the urgency of it, you can get it more in private sector. But it also means it's going to cost a lot more. So that makes it really hard for people to even agree to get help in the first place, even if they have severe symptoms. Right, that makes it really difficult for a lot of people, and not just those with severe symptoms, but also like, for example, those who are older, right? They need mental health services too, but maybe they're not able to get it because it's too expensive.
So like I want help now, but then seeing the price, now what? Now I can't go. And even then, like, I feel like different people has different barriers. It's not just financial. Some people might be able to afford the needs, right? The medications, the therapy, but then they don't have a good support system for themselves. Family members, friends, they're not understanding. And especially with like younger people, if they're still students and then their parents are not, just dismiss them. So then they can't access mental health care, even if they're born in a wealthy family per se. So I
just want to bounce off that. I think that's a very good point, because if you just kind of take a step back, there's a spectrum of clients that may need mental health services, right? And if you look at the background, maybe they may be able to afford it, wealthy family, for example, but maybe their lack of knowledge of what mental health is, that then becomes a barrier for them, even though they have the resource financially, right? Even when we talk about language, you've got people with specific cultural background, and they may not be able to access therapists who have similar cultural background or cultural competence for that. I think one thing I want to highlight is, for example, those who use the sign language, right? They can't speak, and the only thing they can use is sign language. But if you don't have therapists who are competent in sign language, for example, then that becomes a barrier for those who needs help.
I never thought of that.
It's one of those things that I think doesn't get attended to.
Yeah, correct. And it's sad that this thing happens and like there's different barriers. And like not everyone get to access mental health care, at least not immediately.
Not immediately. That's a good highlight.
And then they have to wait like for years, and then they have to do their own research and see, this is how I get to it, but it takes so much time to finally. And then with that journey, they already went through so many other traumas just because they're not treated during that time.
Correct.
And when seeking help, right, I noticed, like I said, more people are aware. And the thing is, some people, they know that something is wrong, they are struggling, but they kind of feel in denial, or they feel like, my problem is not bad enough, I shouldn't I don't need to go to therapy, it'll go away. Even with my personal experience 5 years ago when I was severely depressed, I was like, I wasn't attending any classes for days, for weeks, and I was what people say rotting in bed. But then I was like, there's no way I have depression. But eventually I did get the diagnosis, reach out for help. But so for other people who might experience the same thing, what would you say some signs that it's time to seek help for your mental health struggles?
Right. I think before I go into that, I just want to highlight the fact that when you mentioned about denial, I think denial gets a bad rep. It's like, oh yeah, you're in denial. But I think trying to really look past the denial, there's a reason why people kind of stay in denial for a while, because accepting it is too much to bear.
True.
Right? So you just kind of need this like comfort of knowing like I don't want to think about it for a while. Right? I'm just gonna put a pause on that. Because maybe I don't have the ability to cope with the reality of it.
Yep.
So it serves a function for a while. But then once you're a bit more ready to kind of look past that, then you're able to accept, okay, this is the reality. Now, where do I go from there?
Yeah.
Now, this is the part where, okay, what you need to look out for is when your functioning starts to get affected. That means your responsibilities, your duties, like if you're a student, are you going for classes? You know, if you're a student, is your academic performance declining, significantly from before? Are you getting comments from lecturers, like concerns about attendance and all that, right? Socially, are you isolating yourself? Are you still having your social activities, your hobbies? Are you still doing those things, right? Relationship with family. And it's more about looking at where you are now, like a snapshot, and seeing, okay, is there a big difference in terms of how I am functioning and how I'm showing up today compared to maybe my usual baseline, right? And if there's like a clear indication, that's sort of like a notification.
Yeah.
Like, hey, maybe you just want to check in.
Yeah. I agree with that, and this might also be helpful for parents who have like small children as well. When they go to school, darjah 1, darjah 2, and then they notice, oh, my kids, they're not performing well, or they're just lazy, and then whenever they go back home, all they get is kena marah, and that's all they have to do. But without the knowledge of there's so many other possibilities, autism, ADHD. But I feel like not just the individual itself, but other people need to also to be aware of this, and especially as a caregiver.
Correct. Yeah, as a caregiver, actually understanding the whole picture on why maybe someone may be struggling instead of assuming, oh, they're just lazy.
Yeah.
Or like they just don't care, right? It's a lot more deeper than that. But it does require time for people to really take time to understand and see past that.
Yeah, and that's why we need like the right resources for that as well. Yep. And okay, so let's say someone they already sat down and think, okay, I want to reach out for help, but then there's so many to look into. You can go to a psychiatrist and see a doctor at the hospital, or you can also get therapy. So if you could explain the differences between those services.
Okay. So in general, we talk about the roles of the mental health professionals. You've got psychiatrists, and then you've got clinical psychologists. So I'll talk more about these two first.
Yeah.
So psychiatrists, their role is they are trained in the medical field, right? So their role is to identify a patient's symptoms and look at, okay, in what way can medication stabilize the symptoms, right? So that's their main role, especially in the government sector. So they won't really spend in-depth to talk about, okay, what are the root causes, what are the, how does this affect you in the bigger scheme of things, right? So they just want to look at the symptoms and see, okay, what can be helped at this period of time, like acute management. You might find psychiatrists who also provide therapy, but that one is quite rare in Malaysia. But I think you might be able to find that in private sector more.
Yeah, I think I saw that as well. Some mental health service do that. Like psychiatrists will have appointment with you, but they could also add on the therapy session during that. Yeah,
correct. So it's sort of like an add-on thing, right? But I also know psychiatrists who are very experienced in giving like CBT, psychodynamic therapy. So you have to find the psychiatrist for that. But their role is medication.
Right.
And then with that, we work hand in hand. They work hand in hand with clinical psychologists or psychologists, and our main role is to provide therapy.
Right.
So we are not trained in giving medication. So we're trained in giving therapy. And what therapy is we identify based on our assessment and based on the information that we have. We look at, okay, what are the problem that this client is faced with, and what are the needs of this client. So we'll discuss directly with the client, and then from there we'll create a treatment plan.
Right.
So it seems like this affects you emotionally, so we'll look at emotional regulation, for example, right? And then that's where therapy starts to, I guess, develop over time.
So for someone who don't know, do they have to go to psychiatrist first before seeing a psychologist, or either or?
It can happen either or. So, for example, someone who sees psychologist first, psychologist would also then assess, okay, does this client need medication? Does this client need urgent care because of risk factor, like there's suicide risk involved, right? So then the psychologist will make sure that this client is then referred to psychiatrist.
I see.
For the necessary medication management, right? At the same time, they can also go to see a psychiatrist. Psychiatrist will then assess, okay, is this client okay with just being managed with medication, or will this client benefit from therapy?
Right.
Most of the time, they will still refer for therapy because medication and therapy, they're a lot more effective when they are concurrently.
Go hand in hand,
Correct. So they will mostly go for it. But it's just that maybe many people, they think about therapy and it's like, oh, there's a lot of commitment.
Yeah.
Right? So you've got different people for different reasons, but essentially it can happen at the same time, or it can go hand in hand.
Yeah. That's why even my friend Kira, she said, because she went to psychiatrist and also psychologist, and because she was diagnosed with ADHD, she always says that whenever she advocate other people about ADHD, she says that it's important that it's not just about the pills, and it's not just about, knowing how to survive the day, but it's also how to manage the struggles of daily life that ADHD people go through, and so that they know how to regulate their emotions and process. So she said that therapy is definitely helpful for her, personal journey. So you were right about, it goes hand in hand for some people. And and also you also mentioned to me before the shooting that you wanted to emphasize between mental screening, assessment, and therapy. Could you differentiate between those three?
So this question, I felt that was very important for people to know, because nowadays people hear, screening, and they assume screening is the same as assessment. But if we look at the words, they have different definition and different purpose. So for screening, the whole idea about having screening is sort of like a snapshot of where you are at. Whether your symptoms are showing at risk, or whether it's not concerning level. Right. So based on that screening, that's where assessment will then be administered. So assessments, we use like psychometric assessments and standardized assessment, looking at the client's presentation and seeing, okay, in comparison to normal sample of population or age similar to this client, where is this client at?
I see.
And then from there, we'll be able to identify either the diagnosis or the severity level and all that. So assessment is then needed to ensure that therapy is fully catering to the information that we gather from the assessment. So we can also go it from screening, and then it goes to therapy as well. But it's better for you to have an idea of what it is first, like the baseline, before going for therapy. So with assessment, that's kind of where it is, like psychometric assessments, then we go for the therapy. And therapy, I think as I mentioned earlier, is the intervention that the therapist will then use to address the symptoms that have been assessed.
I see. Yeah. So you don't just come into a therapy session and then start right away.
Correct. So that's why when they go to the first session, there'll be a diagnostic interview.
I see.
So what we call the clinical interview, they come in and the therapist will gather background information, and from there they'll also do some basic screening. Just look at the symptoms, how long has it been, and then from there they'll identify, okay, maybe this client needs a bit more screening. So for example, if this client shows symptoms of depression, then we'll probably add in like a back depression inventory, for example, or DUS, right? Just to screen it out. And then we see, okay, the level for depression is high. That means the symptoms are endorsed on the higher range, right? Then that indicate, okay, maybe a further assessment needs to be done before we go into therapy.
And is there like an average number of how many sessions one person need to, kind of be able to control or learn how to regulate themselves?
That was a hard one, right? Because that one will then include factors like consistency for therapy and commitment for therapy.
Right.
Yeah, so it's hard to say, okay, by right, the symptoms should be better.
Yeah.
But essentially what happened is that the first 2 sessions is mostly for intake interview. So they won't really be learning specific skills yet.
Yeah.
Then the moment they start to build the skills, then you can see the symptoms start to decline.
Right.
Unless, of course, there are actually another thing that's actually enabling the symptoms in the first place. Not really the lack of emotional regulation.
I see. Yeah.
So that's where therapy goes a lot more in depth.
Yeah. So it's different for everyone. It can be months, it can be years. I heard it can also be years.
It can, because different people have different stories.
Yeah. Can people still, like, after they're done with the therapy, they're away for like 2-3 years and then they go back to therapy? Is that also a normal pattern?
Very normal. I think with therapy it's a very unique and a very special relationship, because when you speak to the therapist, the therapist knows a lot about you.
Yeah.
But you may not know much about this therapist.
True.
Right?
True.
And there's a good thing in that, in a way, because then you feel like I can always go back to this person and they know where the bookmark is. The last time they know me, this is the information that they have.
Yeah.
Right? So it makes it a lot easier for them to come back to the same therapist for continuity purposes.
Yeah. Agree. And sorry, is this correct? Correct me if I'm wrong, but is it true that not all therapists is going to be the right one for you?
It's so true. It's so true. Same thing with, like, not all GPs are going to be the right GPs for you, right? Same thing as well. But I think with therapists, it's a little bit more intimate in a sense where you want to be able to have that connection with the therapist.
Right.
At the same time, it's also fair to give enough time for the connection to be built. True. Right? Because sometimes people just assume, okay, this person's a therapist, so they need to know exactly how to meet my needs in the first session. And it's like going on a date. Like, you're not going to be able to find the right therapist or the right person after the first date, right? So you have to have that number of sessions to really see how this therapy gel with you and how you gel with the therapist.
Right. And so if that's the case, like, what are some signs that the therapist that you're seeing is not for you? What can one person do? Do they communicate it with their therapist, or do they just like, okay, I'm done, I'm going to go find another therapist?
Right. So honestly, I think with that, the most important thing that we want to identify is, like, clients, is, okay, do I feel safe to open up to this person? Of course, that depends on how many sessions it has been as well. Like, you can't expect to open up after the first session. We give it some time, and then after a while, kind of just assess, okay, where am I at with this person?
Right.
If I feel this, like, barrier to open up, because every time I open up, I feel like I'm being shamed or being judged, that's a good kind of like a good sign. You know, that's like, okay, something is up here. Right. But again, don't jump straight into the conclusion that, this therapist doesn't care. Yeah. Give it some time as well. And then if you have the courage to speak up, it would be a good time to actually highlight to the therapist, like, hey, this is hard for me to say, but I am struggling to find you in the middle, like meet you in halfway, because I feel this, right? It is really scary to say that, to be honest, right? And I know a lot of clients struggle, but if you're able to practice that with your therapist can then help you through that.
I see.
Because then it's like you practicing your assertiveness, right? You communicating your needs. And the best place is actually practicing it within safe space.
Right.
So when the moment you feel like something's not right, just take a step back and assess first and see what's going on. And then after a while, then you bring it up to your therapist. And if your therapist is really there with the same goal as you, your therapist will be able to meet you halfway and communicate, okay, maybe there was some, miscommunication in the sense. So how can I best support you? Right. So we can continue with this journey.
I think that's a great advice, and like knowing exactly when and how to manage that. And that's in terms of the mental health care with your relationship with your therapist. How about like outside of that support system? Because I noticed that it's not that families and friends don't care, but some people, they do love and care about you, but they don't know how to handle that situation. So they might give like unsolicited advice or harmful advice. It's like, why didn't you pray, or why didn't you exercise more? You should do this, should do that. But they don't have any ill intentions. They just don't know how to adapt to that situation when they know that someone they love is struggling with their mental health. So do you have like any tips for friends and family on how to best support someone who is struggling?
Right. I think this is such a good question for a lot of people, regardless of at what point we are in, right? When we talk about giving support, I think the most important thing is being able to listen and really listen, and not just hear, right? There's a difference between hearing someone out and really listening to them, and that does require a lot of patience and a lot of understanding that it's not about you, it's about them, right? Like, how can I best support them instead of doing things that make me feel less uncomfortable by giving advice, because giving advice makes me feel like I'm doing something about it, right? But really meeting them where they are, which means that being honest about, okay, I really want to be able to help you, but I'm struggling to understand how. You know, how can I meet you halfway? So that's one. Number two is actually being more, I guess, aware, more educated on in general what mental health is. Right? And I think the more in touch you are with someone's mental health, then the more able you are to meet them halfway. Not just for them, but also your mental health as the person who's trying to give support, right? If you're aware of your own internal world, it's a lot easier for you to be in touch with someone else's internal world.
Yeah, this is the same that applies to what we said before about caretakers. This is where they need to play a role. Like, it's also part of their responsibility to understand and research on what mental health and what kind of, let's say if they have any diagnosis, on how they can cope with things. So it's not just one person responsibility, it's also everyone around them to help with the healing journey, right?
Correct.
And so that is, I think we covered quite a lot on the, mental health care and also understanding the basic terms and services. But what about in this situation, someone is completely burnt out. They completely burnt out and they have completely isolated themselves from everyone else. So to think about just reaching out for help is overwhelming because there's too many steps, and then even to socialize might be very anxious and it's just hard for them. So in this situation, what step can someone take, to get out of this?
That's a hard one. That's a whole therapy session.
True.
But essentially, right, what I always try to keep in mind for myself as a therapist when I'm dealing with someone who is severely burnt out or just very isolated from everyone is, at that point, it's not really about the technique. At that point, it's just about coming back home to yourself. Right? And just kind of reminding yourself, okay, what's this one thing that I can do to just make this space safe for me? Right. Building a sense of safety is the most important thing. If it means going back to like a familiar routine, then we do that. Right? If it means just, making tea for yourself that day, then we just focus on that. Right? Building a sense of safety and routine really gives you like this idea, okay, I've got a bit of control and a bit of agency. Now, how do I build from that? So it's not about, okay, you have to go through, go reach out to this number therapist. You have to follow all these steps. It's just even the basics from my personal experience, from what I observe with my friends. Sometimes it's just the smallest thing as like your friend checking in on you, because when someone is burnt out, they cannot do anything. So if just you're, okay, I'm here now, do you want to eat something? Do you want, just like this little small actions can help someone get out of that spot and like, rotting in bed. Absolutely. I think it's just knowing that there's people waiting and they are checking in ways that they know how, and you know that you can take your time. I think like when you feel rushed, feeling that, oh, I have to get better because people are waiting for me, that kind of makes it a lot harder, right? But if you're able to get to this place where it's like, I know they're waiting for me, but they're not expecting me to get better anytime soon, I can just be in this space for a while and make sure that I'm not hurting myself along the way. Not just self-harm, but also, am I worsening the situation by digging deeper and deeper and deeper? Right. Or am I just focusing on this one thing that I can do that move me just 1 inch closer to another direction that I want to head towards?
And I think this also takes skills for the other person who is, observing this happening. They have to have this thing, the unconditional love. Like no matter what situation you're in, if you're, you're not able to finish your work, you're not able to do this and that, your responsibility, it's okay, I'm still here for you. And that's what helps someone to get out of that.
Right. And I think in the same line as you mentioned, once they are able to receive help from the outside, only then other sort of services become more receptive. Right. So then they'll be more open, like, then I think I can reach out to psychiatrists for medication, so then I can start to stabilize a bit more. Right. Or I can go to see a therapist, so I can open up a bit more. Right. So it's like different layers that
it takes small steps.
But sometimes the first thing is just focus on that first step.
Right. Yeah. And then it takes years to...
it takes a while, But I think not trying to focus so much on like the whole journey as if it's like a one chunk of journey,
Yeah.
but looking at it like, okay, it's just one small step at a time, so it feels less like overwhelming.
Yeah,
you know?
true, correct. Okay, so I think we covered quite a lot already, and I hope like a lot of people, learn from this. But just for the last question, what advice do you have for individuals who may be hesitant to start seeking help for their mental health?
I love that question because at the end of the day is how do we make this more accessible to the person who
Right.
is finding it hard to accept in the first place, right? I think the most realistic answer to that is to find someone who has had experience seeking help in the first place.
Right. Yeah.
Right? I guess normalizing the fact that help seeking behavior is okay. It's okay for you to seek help, and hearing it from someone else's story and just seeing and observing how is that like for them. But of course, not just using one person as reference because that could be quite biased.
Yeah.
Right? But really just allowing yourself to hear more stories about their experience, and then start somewhere there.
Yeah. And I noticed that this is also helpful. This is where like social media and online forums can be helpful because people find their own community, and that's where they can relate to there and find resources from other people who has experience, like you said. Yeah. So I think that's quite a lot that we've covered. Sorry, I'm a bit nervous, but I think that concludes today's episode of Let's Talk About It. I hope all the listeners found this conversation as enlightening as I did, and thank you again, Miss Aishah, for all the sharings and knowledge. So for everyone else, remember that your mental health matters, and if you enjoyed this month's episode, be sure to subscribe so you can keep up with new episodes. But for now, take care and see you next time. Bye.